Hey there, Dr. Alan Christensen here with you. I want to talk about the foods you really must avoid with Graves' disease. There's a couple of categories of things we'll talk about. The first category is going to be food allergens. And food allergens come in a few different types too. We got categories within categories. So the first big category would be the anaphylactic food allergens. You may know of someone who can't eat peanuts or else they can't breathe, or a bit of shrimp in their soup could land them in the emergency room. These are no joke. These are a big deal. So peanuts, shellfish, berries, they're some of the biggest categories that can trigger that. Now this is relevant in a couple of ways. If you've already had those reactions and know it, you got to avoid the foods even more so now. And it may be the case that in the past you knew that you had a certain amount of tolerance. Maybe you could have a little bit here and there and you'd be okay with it. Well, that tolerance could be different now. It's probably going to be a lot lower than it was in the past. So please just completely avoid those foods without question. With Graves', your body has a much higher level of histamine present. So any reaction like that that could occur could be amplified over what it was when you were not in the Graves' state. The other thought is that if you've not had those reactions, you could develop them. So please be conscious about some of those more commonly anaphylactic foods and do avoid them or do use them less often because you could develop reactions you never had before. The other big category of food items would be caffeine. So full spectrum, there's caffeine, theobromides, theobromates. There's these different compounds that act like stimulants. Now with Graves' disease, you're making a couple pots of coffee on your own every day. And that's the problem. So caffeine is so much stronger. And in many cases, it greatly amplifies the symptoms. The palpitations, especially, the nervousness, the tremor, the anxiety, the sleep disturbances, the wasting type issues, the blood sugar instability. It just takes all that and amps it up. The other problem with Graves' disease is that the way your liver breaks down caffeine and manages it, that's also compromised because it's working so hard to stay caught up on the extra thyroid hormones. So your body has less of an ability to respond to caffeine, and what you do take in hits you harder. So it's a double whammy. So we think about coffee, and in terms of right now with Graves' issues, even think about decaf as being in that category, because decaf is not no caf, it's still some, and it's surprising the amounts can be pretty erratic. You know, some decaf is almost as much as what caffeinated products would have anyway. So coffee, all teas with the exception of herbal teas, chocolate products, energy products, you know, even a lot of some of the herbal energy products, guarana you'll see, or mate as some common ingredients, but these are all stimulants. And the problem right now is your body is being overstimulated. So even if you did well with it before, what can happen is that, say you've been a two cup of coffee a day gal for years, no problem. Now you've got Graves' disease and there's these symptoms. Guess what? If you're off the coffee, the symptoms may go down by half or 2/3. So the symptoms wouldn't be caused by the coffee, but the way the coffee affects you now is completely different than it would have been beforehand. The other big food category to think about would be processed versions of sugar. Now, I always want to make a distinction between what a baker calls sugar and what a chemist calls sugar, because I don't want you to cut out all carbohydrate. That's actually going to be really bad for you. So to a chemist, any carbohydrate is a sugar in terms of a broad category. To a baker, however, that's not true. You know, a baker can't use pinto beans as a sugar to make the dough rise, even though chemically it contains a sugar. So we're talking about the baker's sugar, the white stuff that says sugar on it that comes in packets. That's the type that can cause difficulties with blood sugar, and that can also cause your cortisol to become erratic, which is a special concern with Graves' disease and the tremors and also the Graves' eye symptoms. This can worsen some of the panic attacks, and it may take 30 to 60 minutes to show up. So it's not always obvious that you just ate that food and now you're not feeling well, but it could still be a culprit. So big things to think about and watch. So the reactive foods, the caffeinated products, and the sugars. Avoiding those can go a long way towards helping the Graves' symptoms and moving you closer towards your reset. Dr. Christensen here with you. Take great care. We'll talk again really soon. Bye-bye.